So we can do this.
Okay.
So that's there.
Okay.
Yeah.
Dr. Roy Tefa, who was also with us today. We have the IT who are currently also on the call. We have Lily Bessard, who are acknowledging the presence, and we have Sister Patricia, who is currently on the call. Thank you. So we have Mr. Fabian Chamanu, who is 37 years old, who stays in Lusaka, in Berkeley Estate towards McKinney South. He had COVID multiple times. The first episode was in 2021, which was diagnosed through PCR. And then in 2021, he had 3 episodes of COVID. And then in 2022, he also had multiple episodes of COVID. And the last infection was diagnosed in 2023. None of those infections had required hospitalization. So from 2021, after the first infection of COVID, Mr. Fabian had started complaining about chest discomfort, dyspnea, anosmia, but also he's been complaining of intermittent loss of taste, extreme fatigue, forgetfulness, poor concentration, lack of interest in day-to-day activity. And the most striking thing is Mr. Fabian had raised many times that he feels like he's not in control of his body. Had noted the change in sleeping pattern, though he had denied any seizure, any fever, any night sweat, or any of the other respiratory symptoms apart from dyspnea. The past medical history, Mr. Fabian has been suffering from bradycardia, still investigating the cause of bradycardia, but also anosmia also has been there, and it's been going subsequent time to ENT to investigate for the reason of him having anosmia, but also is a non-asthmatic patient who is currently on medication. The family history is only issue of diabetes and hypertension. He's single, works in the IT, has no allergy, doesn't drink, he doesn't smoke. And in terms of medication that he's currently taking, he's taking some allergy medication, and then also nasal spray and some medication for asthma. So this is the timeline for lab and radiological examination that we have done from the time Mr. Fabian had reported to UTH. In 2021, we have done a panel of tests. Among them, there were HIV tests and baseline tests, which was mainly non-revealing. In 2021, few months after the first visit in UTH in October, he had done other tests which was requested by various specialists, among them the D-dimer, which was elevated, and then he was treated for that as he was investigated for the potential cause of elevated D-dimer. In 2021, in the month of November, a month later, he had repeated some of the tests which had noted an increase in D-dimer, though the CRP, there's a mistake here, the CRP and the ALT was mentioned to be normal. In addition to the laboratory examination, we had done some radiological tests, which was also basically normal, apart from the first degree AV block, which was noted to be there, but this was mentioned to be there prior the event of the multiple event of COVID. So what was done during the time that the patient was at UTH, we had, of course, made him visit various specialty, among them pulmonology and psychiatrists. So in 2021, when he came through a mail, he had seen the pulmonologist. I remember this patient was complaining about dyspnea and chest discomfort. So after the episode of COVID, they had requested for him to undergo spirometry, which was normal as the table had shown, and CT as well, which also was normal, and then some repeated CRP and E-dimer as well. After various evaluation, he was also requested to see the psychiatrist, who had been consistent in diagnosing him with depression. So on the first time he was diagnosed with depression, he was prescribed some fluoxetine, which is an antidepressant medication, which he took for 1 month. Unfortunately, during the course of the medication, he had developed some drug allergy to the medication, which had held him to stop the medication. But because also of the anosmia, the patient also was requested to see ENT, who had requested to do a brain CT, but also to continue the nasal spray as he was in ENT's care. Psychiatry has been the main specialty that had been seeing Mr. Fabian, who also had, like mentioned initially, was persistently thinking that he has depression. And then he was seen without medication at that point. In 2022, he was reinitiated in medication and anti-psychiatric medication, which he was reluctant to take. So far from 2022, Mr. Fabian was not taking, though he was seeing the psychiatrist, he was not on any medication. So from the time that Mr. Fabian had joined our facility, he's been seen by pulmonology, psychiatry, ENT, and neurologists that are currently seeing him now. So on the last visit in May for the neurologist had agreed with the depression disorder, but also he was diagnosed as well with anxiety, severe anxiety, and had recommended behavioral therapy without putting him on any medication. So this is just a gross presentation of the patient, but the best person to talk about his situation is, of course, Mr. Fabian, which will give the floor to. Mr. Fabian, good afternoon again. I know we have discussed, and then we had, you were very happy to join the call today to speak about your experience. Please let us know on what has been going on from the time you were diagnosed with COVID, what you have been going through so far, and especially how this battle that you've been going through had affected your day-to-day life.
Right, thank you for having me. I think the saga began in January of 2021. I had my first encounter with COVID. At the time, I didn't know it was COVID, so I kind of delayed to come to the hospital. By the time I came through, it had progressed to pneumonia. I was given treatment for that. And after that, I did notice, persistent problems. Now, I assumed at the time it was just the pneumonia that, was still somewhat remaining in my system and still had a way to go to come out. But I did realize the fatigue was probably one of the most notable issues I had at the time. So I could not go back to normal daily activities. And every time I tried to do something that I would normally do, like, exercise or anything of that nature. I kept on finding myself like trapped in this cycle where every time I'll try something, I would wind up experiencing what I would call a crash. And it's like I'm sick all over again, and now I can't do anything. And this kept on happening up until the next time I got the virus. It was mid that year. I did get infected again. This was around the time that my grandfather passed away. So there were a lot of things that were going on at the time, of course. I couldn't work any longer because of my condition. Obviously my finances were affected, but there were family issues that crept into that because my grandfather was like a father to me, so losing him was quite difficult. It was a process dealing with that, and obviously all the drama that comes along with it. But at that time, it was around about the funeral that I actually got infected again. So there was a lot of people that came around for that funeral. And as a result, I actually wound up getting into another loop. So this second time when I got infected, I think that's when the symptoms really hit hard. So the first time, the symptom that was very persistent was my inability to breathe and my, the consistent crashing every time I tried something like working out and stuff like that, which is something that I used to love doing. I couldn't do most of my daily activities any longer. But initially it was the fatigue and that cycle. But then by the time I got my second infection, this is now when a slew of different types of symptoms started to creep up. Now, at this point in time, I didn't even know anything about long COVID or anything related to that. So all of that was, it was not even on the table. I just assumed that it was the pneumonia, it's going to come out and it's going to be fine, And then when I got my second infection, this was the time when I really started to freak out because I started to lose my cognitive sense. I think amongst all of the symptoms that I've had, yes, I did lose my taste and smell at that time. From that time till now, which you can imagine is quite depressing. I can't remember what anything tastes or smells like anymore. It's been almost 4 years now. I have no idea how to deal with that and how to come back from that. But yeah, that has definitely affected my quality of life to a significant degree. But by this time, the second infection, some of the more scarier symptoms started to come up. Yes, there was the constant disability to breathe in and out properly and all of those things. But then none of that was new to me because I was an asthmatic, although I did not have those issues for many years. I think the last time I had any problems with asthma was when I was still a teenager. So from then until now, I've never had any issues with breathing and stuff like that. But this did come back and it was a little bit more severe than what I experienced then. But as life-threatening as that felt, I think the cognitive sense was one of the most scariest symptoms I got because my brain just couldn't function anymore. There was a disconnection between my mind and my body. I did not know how to do anything anymore, like just walking, simple tasks like walking it was not something that I could do subconsciously anymore. Like when we walk subconsciously. Your feet are calculating the terrain subconsciously. You don't have to look at it and realize that this is higher, that's lower. That was not functioning anymore. Just to get up and go to the toilet would take me 30 minutes just to figure out how to do that, which was quite difficult. At this time, I started to feel like I think I'm going mad because even simple tasks were impossible. At this point in time, I remember that was when the depression really kicked in because the only thing I could think of at that time was suicide, to be fairly honest. And for whatever reason, it was a thought that I couldn't control. And that's what made me more frantic about the situation, I guess, because I felt like I was no longer in control of myself. So it's one thing to have thoughts of it, but it's another thing to have those thoughts and not be able to control yourself. So it was like, I really fear that this was going to happen and I was not going to be able to stop myself or control myself from doing it. And going through that was really, really scary, especially not knowing what was wrong with me. At the time, again, I didn't know anything about long COVID. So I had no idea what was going on and why all these things were happening. And it was a lot to deal with that. I've had to go through a lot personally just to try and bring my mind back into a mental state where I can function, because I couldn't talk, I couldn't walk, I couldn't just do basic functions. So I had to do very simple tasks. I don't know if there are other people that have experienced this. I know a lot have, but I had to try and do very simple tasks like playing around with words, just simple little games to try and exercise my mind, to bring it back to a form of what it used to be. It's not as good as it used to be fairly honest, but I have done a lot of work to kind of get it back to a state where I'm kind of still functional, but I still do have problems from time to time where I forget. I could be doing something I completely forget. So moving on from that,
before you proceed, so those symptoms that you had in 2021, are you still experiencing all of them now?
So
there's some that have subsided, or there are some that have worsened?
So when it comes to symptoms, I actually used to compile, I can flash this really quick. This is a list that I have been compiling of all the different symptoms that I've had. There are over 30 symptoms here that I've had to deal with over the years from then until now. And some of these symptoms are consistent. Some of them are consistent and then they worsen and then they kind of go back into their consistent state. Some of them seem to be opportunistic, so they kind of just jump in and jump out. And maybe they'll just jump in once and then never show up again. But some of them are more persistent. They kind of repeat. And I would say some of the more severe ones have been the pain, the chronic pain, mostly throughout my body, chest area. The chronic pain is very difficult to deal with. It comes with migraines and all those kind of things. Pain medication wasn't really helping that much, so that was very difficult to deal with, and it was very consistent. The fatigue was monstrous. Gosh, the fatigue. I would wake up in the morning and I feel like I didn't sleep at all. It felt worse off from sleeping than I did from being awake, if that makes any sense. So waking up, I felt more drained waking up than I did when I was going to bed. And this is quite persistent. So this is how basically my days go. When I wake up in the morning, I am very dysfunctional. Monstrous fatigue. Most days I don't even make it out of bed. I will judge by about 11 when things start to settle down. So when the fatigue kicks in and when I wake up, it's like a lot of symptoms just jump up. I'm like, yes, I feel this, I feel that, I feel that. And then maybe about around 11, closer to noon, some of them will start to calm down a bit. And then that will determine what I can get done that day. And sometimes it doesn't get any better. So that entire day, I just know this one is gone. I can't do anything today. And that's the cycle, basically, that has been quite repetitive. I've had so many other problems. I had near perfect dental care. I had no issues with my teeth until this happened. My teeth became brittle, they started cracking, they started breaking. I had to start going through several procedures at the dentist. This was, this had a lot of psychological impact for me because it was something that I felt was very important. I took care of since I was a kid. The first time I had a cavity, I told myself this is never happening again. So I would stay away from things like sugar and all that kind of stuff that would ruin my teeth. But, having to have taken so good care of my teeth and then having to experience this, that then brought up the same thing that I spent all this time trying to avoid, that was very difficult to deal with. Especially psychologically, that did impact me quite a bit. But again, there were a lot of other factors that, came in to affect my life externally and internally as well. So the symptoms that I've had are quite a bit. This is just like the tip of the iceberg. If we had to start getting into them, we could spend the whole day. It's been, the best way to describe it is that it's been a nightmare dealing with this. I only learned about long COVID end of 2021. That's when I actually got to know that it was a thing. But by that time, I had already suffered from so many different things. I had no idea what was going on with me. And I learned about it online. And I think maybe this is the part that I really wanted to bring in and make sure that I don't leave out of this presentation. When I was going through all of this, most of it I had to experience. Actually, let me just say that 99% of it I had to experience and go through alone. Every time I, would come to the hospital with these complaints, I was constantly told it's all in your head, it's all mental, you're fine, all the tests come out fine. So that means that you should be fine. And therefore, everything that you are experiencing is all psychological. But there were a lot of physical symptoms that were there. So to be fairly honest with you, I didn't really receive any medication to speak of outside of the medication that I got from the psychologist that I reacted to.
Yeah.
So outside of that, and the first medication that I got when I first came through, which was azithromycin, that was an antibiotic when I had the pneumonia. Outside of that and what I'm taking right now, I really didn't receive anything because the general consensus was that we can't see anything, therefore we can't treat anything. So this was very difficult to deal with because every time I would go through all these different stages with the different doctors, I was constantly told this is all in your head. And at the same time, I was really suffering, right? So I do understand that, yeah, a lot of things that you suffer physically, can turn towards the psychological state. And a lot of the psychological things that you face can also manifest themselves physically. But at the same time, I have dealt with things like this before in terms of where the bradycardia is concerned, how that mind and body relation is concerned. So I was very much aware that, I'm not imagining this. This experience is real. And all the things that I'm facing is not stuff that, I'm just conjuring up out of the inner workings of my mind. So the reason why I bring this up is because towards the end of 2021, early 2022, I think somewhere around that time, that is when I first saw a documentary of a lady who was experiencing long COVID. That's when I finally found out what this was, right?
Was it a Zambian?
No, it was not a Zambian lady. She was from the United States. So she was talking about her experience and the things that she went through. And it's funny because the way that she narrated what she went through, I felt like she was talking about my life. Because everything that she mentioned are things that I went through myself and I could tick all those boxes. And it was amazing for me because this was the first time I was actually noticing that, okay, I'm not just crazy, right? There is at least one other person that's going through what I'm going through, right? And this was another thing, the segregation that comes around with this. I'm sure a lot of other people have experienced this. That you will experience from your family, from your friends, from people around you. It does add to the psychological aspect to this trauma. So because everybody just looks at you and says, you're fine, right? And you're not fine, but then everybody else claims that you are. And not knowing anybody else that's actually going through what you're going through puts you in a bubble. And that can be very difficult to deal with. When I did actually find that, I was not the only one experiencing what I was experiencing, she mentioned a long COVID support group online, which I looked for and found. And I think this was my lifeline, if I'm absolutely honest with you. This was my lifeline. When I did find that support group, the many times that I felt the anxiety and the depression and the suicidal thoughts and just feeling like giving up because this didn't feel like it was ever ending. When I found that support group and I found there were millions of other people that were experiencing the exact same things I was experiencing in the exact same way, and not just physically in terms of the things that their body was reacting to or how it was behaving, but even socially, the experience that they had with clinical physicians, the experiences that they had with family members, the experiences that they had socially, all of these things were just like, it was resounding. So I would not like to call it an echo chamber, but it was essentially an echo chamber of some sort, where what I've experienced is exactly what millions of other people are constantly going through, right? And this was very helpful for me dealing with this, mostly because at some point I did eventually give up on pursuing things medically because I couldn't find any help there, to be honest. I think the only time when I have actually found, and to be fair, especially with the case of the medical physicians that saw me, there was one doctor who was quite helpful. He took time out of his schedule to really see me personally. To be fair, it's a novel disease, right? So it's very new. And with the way that it kind of hides itself, I do understand why most doctors would have just kind of written it off and said it was just psychological and there's nothing else outside of that. I would not like to be in the position of a doctor dealing with that situation, to be fairly honest. I could tell really how difficult that would be, but again, it's equally difficult for both the patient and the doctor. So yeah, I think the most help that I've found is just recently when I came to the long COVID clinic here. So I found this via Reddit. I've been planning to go and get my blood work done and tested and dealt with properly because I had some serious clotting with a doctor in South Africa who had talked about the microclotting a lot and stuff like that. So I really wanted to find out if there was another place I could do that here because that was a little bit expensive. And so after I completely lost hope and I just felt, I stopped coming to the hospital because I was not really getting anywhere. Not necessarily because I was better, I just didn't really receive the help that I needed at the time. And most of the medication I had to deal with myself, right? So at this point, I wanted to find out if I could do certain things locally. So I went to Reddit and I just made a post and said, look, I'm looking for any doctor that, deals and specializes with long COVID patients. That's not going to gaslight me and make me feel like, again, it's just all mental, like what I've experienced. And from there, somebody just responded and said, there's a long COVID hospital going on at UTH, right? And I looked at it and reluctantly I said, oh, yeah, I've been there, done that. Well, not the long COVID hospital per se, but I've been to the hospital itself and I've gone around those loops and really nothing has come of it, but let me give it a try, And that's kind of how I wound up here, And I think from coming to this point, this is the most help that I've ever received in terms of just even affirming my situation, I would say, and what I'm dealing with. The ENT that I saw, Dr. Skazwe, he was really good. I could tell that he actually did his research on this. Even when I was speaking to him about it, we actually bounced back some ideas and thoughts on it. And yes, I can see someone is saying that they can relate very well. I'm thankful that I can reach out and help. And so, when I saw him, he we were able to really bounce off ideas and information on this. Because again, I had to do a lot of personal study and research on this because I realized I was not really going to get that help here at the time. So I do know a lot more than I probably should in the medical field because of this. But yeah, this is one of the few doctors that I could really relate with when I was talking to him about the problems, and he was quite aware. Most of all the other doctors that I've spoken to, whether it's a dentist, it's this, it's that, they just seem very clueless. Even when you talk to them about it, it's like they have no idea about that existence, which again, I can't really blame the doctors here because this was something that was synonymous globally. Everybody was complaining about the same thing, whether the person was in America, in Europe, it didn't matter. Even people in the long COVID group were, had the exact same experiences with their physicians, not being too aware or mostly being dismissive about patients dealing with these problems. So I think things are changing. Things are changing. I can see the change. It's not the same as it was a couple of years ago. I think there's definitely a positive change. So just to encourage other people that have gone through this experience, that are still going through it. It's again a novel disease. I think it's very new. So everybody really had to learn on the fly what really is going on here. And I think we're still doing a lot of learning. But yeah, that's currently where I am to bring it all in a nutshell. Yeah.
Thank you, Mr. Fabian, for your testimony. For what I get from your talk is you are really, like, you've been stigmatized.
There was a lot of that, yes.
There was a lot of stigmatized around your sickness, around what you were going through, because after those multiple visits in the hospital, nothing was actually found. So even the medical personnel had
developed
that stigma against you, and then labeled everything, saying that everything that you think you are going through is in your head. And unfortunately, without getting the help that you needed, even worsened and started having some suicidal thought. Fortunately, you had segregated also from your family, which was not able, who were not able to understand what you were going through. From your medication chart that you had, that I had seen in your review, you were given 2 medications. So from what we've seen is the only palpable thing that we have, the diagnosis that we have come out, the unanimous diagnosis that we have come out with is severe depression. So when you were told 2 or 3 visits after that you had severe depression, you were given some medication. There's one that you have reacted on, but the second one you were reluctant on starting on the medication. Can we know why? Is it because you felt like you still wouldn't get the help?
No. When I saw the psychiatrist, there were 2 medications I was given. I took the second, but the one I had to pull out.
The one that you had.
I can't remember what the name was. I'm sure yes, that one. That's the one. That's the one. But again, it was around the same time when I experienced the mental dysphoria. So I think when I was trying to figure out what was going on, I was looking at the side effects of those drugs, and some of them were also kind of, so I believe that it exacerbated, because apparently a lot of patients that have long COVID also experience brain fog.
Yes.
Right, which was something that I was dealing with at the time. And like I said, if I say it's so scary, it was really scary, because at one point I literally was unconscious for 4 days straight. I literally could not stay awake, and then I fell asleep on a Thursday, woke up on a Sunday. That was several days later. I had to be rushed in. So, that was the same time I was taking those drugs. Right. But the cognitive problems, I think, just started slightly before or just around the same time. So It's hard to tell if it was a combination of both or if it was just the drugs themselves, but I was taken off those drugs.
So the medication which was prescribed to you, well, you can't say they were worsening them, but the symptoms were more.
Because of the way that the timelines met, it's very difficult to, say that this for sure is the problem. Yeah.
So, before we start looking at the
It's kind of the same,
Danielle?
sorry to interrupt, but it's kind of the same with what I'm dealing with right now.
Okay.
So right now I'm having auditory problems. My ears, for the past 2 months, suddenly just couldn't hear anything, just massive ringing, vertigo all the time. That's the main reason why I had to go and see the ENT. But at the same time, I was on aspirin, right? So I did look up the aspirin side effects. There's some relation there. So when I was speaking to the doctor, he was asking me, okay, but you can still take the aspirin. I said, no, let me not take that anymore until we've sorted out this problem, because I don't want to lose my hearing as well. I've already lost my smell and taste. I don't want to lose every sense that I have. So that's, yeah. It's another one that, again, I can't say for sure if it's long COVID related or if it's medication related, but a lot of people who have long COVID have experienced the exact same thing in the exact same way. That might also be because they're taking aspirin, because of the clotting and all that, the calculation and all that. So I don't know.
So on the course of the thing.
The network.
Okay, so we have some message on the chat from Ms. Boa that said, I can relate very well. What you have said is what I went through and I'm still going through some of it even now.
Maybe you want to unmute your microphone.
Ms. Boa, can you please unmute your microphone and maybe tell us more on what you have been going through and you are still experiencing now, and did you reach out to any of the long COVID clinic?
Mike is still.
Okay, there's a question from.
Okay. Is it the one down?
They want to say something.
Okay. The people from DREA. Long COVID rehabilitation has raised their hand. Please unmute yourself and you can ask your question and or give feedback.
Thank you so much. This is Dr. Dalal from Mazabuka here, and we have over 30 healthcare workers here present with us, and we really appreciated you sharing your journey with us. One of the things that we've realized and what we often share is the best advocates are people with lived experience, and your journey is actually so profound that it's also making us be better, not just as healthcare workers, but also be better as human beings. So thank you so much. We just wanted to appreciate you for starters. But my question as a mental health specialist to you, Dee, is that you've had to go through a journey of self-actualization and also realize what is it that you're going through, what you went through and what you're going through didn't have answers in that moment. And you were figuring it out yourself, and you had to go through the, group discussions yourself. You joined the long COVID group online and all that, the journey that you went through. What guide would you have to us as healthcare workers to help, others who are living through this experience better? Because we want to be better as healthcare workers as well. So what guide can you give us so that we can support individuals such as yourself and others better as well? Over.
Okay, that's a good question. Yeah, no, at first, because you said D, I thought you were talking to her. All right, no, it's fine. I understand. Like I said earlier, I thank you for the question, by the way. It's a very good question. I think, like I said earlier, the experience initially was not that great with the healthcare system. I didn't really receive any help in terms of it. But like I said, I think there is an issue here with the novelty of this because it was all new and people didn't really know much about it. So it was very difficult again to deal with because again, most of these tests were coming out normal, which is the case with pretty much every long COVID patient, except for some of the things that would literally show that there's a problem here and a problem there. The D-dimer was really high and, several other things. But outside of that, most of the other things that we were chasing were kind of like ghosts. So I would say that from my experience, and I say this because I have a cousin who is also in the medical field, and he was actually telling me a story about how he works at the dispensary, so he's giving medications over to patients. So there was one particular patient that had some STI of some sort, and he was giving him some medication, and it seemed that it was not improving. So he had reached the point of even shouting at the patient, saying, "Hey, man, I gave you this medication. You're not taking the medication. What's wrong with you? Why are you not improving?" Right? So apparently one time he was listening to the news on BBC, and they were talking about that very same STI and how the medication that is formally known to treat it, it became resistant to that. And there was a new medication or an alternate medication that they were using that actually worked better, right? And then when he saw that, when the patient came back, he said, "Okay, look, let's not use this, let's try this," right? And apparently after he switched that medication, the patient saw a significant improvement. And so when he was telling me, when he was iterating the story to me, he was saying, "Look, I think one of the things that needs to improve," and I agreed with him, was awareness in the fields, right? I know you guys have a lot of things to deal with because there are a lot of different anamnesis and sicknesses and illnesses that people are dealing with all the time, but these things do change and they evolve. And, keeping apprised with what's going on. I think this is one thing that I faced that I realized was really a big problem in the medical field that discouraged me altogether and led me to the point of just giving up on it in totality. It was the ignorance level that I saw. I'm sorry to use that term, but it seemed that a lot of doctors were not apprised with what was going on. We're not really connected with the patients per se. And again, like I said, I don't entirely blame the doctors because it was new, most of the tests were normal, so it was easier to just discredit. But in actuality, this left people in a stigmatized situation that was very difficult to deal with. I know because at one point, one of my family members, wanted to tag along. This was after years of my being sick and nobody attending to me and just watching. Right, they finally decide, you know what, we've neglected this person too much. Let's try and, help them out. So I want to come with you to the hospital and see what's going on. And then you get there and then the doctor's telling you, "You're fine. There's nothing wrong with you." And then they turn over and then look at your family member. This guy is okay. It's all in his head, right? And everything that he's experiencing, it's all psychological. So I want to tell you this because he's not going to listen to it, right? This is the experience that I had, and I can tell you for a fact that it did not help. It didn't help at all. What it did was really worse than the situation because it made me realize that I'm helpless here, right? The people I'm supposed to go to expect to, get some kind of help or answers are writing me off, right? And they're putting me in a more precarious situation with my family and the people around me, right? To solidify this idea that everything that I'm going through is non-existent. Even in light of the actual physical symptoms that people can even see, and even the doctors could see when I would go there and see them. There were several, like I showed you on that list. It's just that we don't have time. I would have taken you through all of them. But yeah, I've had to deal with so much that was never a problem before, that now is consistently a problem in my life. It has changed my life in so many ways. So yeah, I would say that in terms of the doctors and the people in the medical profession, I would really advise that you keep apprised with what's going on. But also, one thing I recommended to one of the doctors was to also consider joining some of the communities where these people sit and discuss these things, like the long COVID support group. I think it would have been really much more helpful if we had a lot more physicians early on in those communities to really hear what people are talking about, what they're actually going through, so they can realize that this is not an isolated incident, and it's really something that puts a lot of pressure on the patients.
So thank you, Mr. Fabian. So to answer your question, Dr. Dalao, Mr. Fabian, to rephrase what you said, the medical personnel needs to be well informed of the disease, and then communication to the public is very important. Okay. Would like to ask Ndoko, is there any other question anyone?
I think I saw a question somewhere in the chat.
Miss Boa, you have mentioned that you are still going through the similar or almost similar of what Mr. Fabian had mentioned. Would you be kind enough, please, to unmute your mic and maybe relate a bit of your story? Okay. Okay, another one is Dr. Naik, who said thank you, and then that he had heard about the cause of the illness and is glad to talk about it. However, how do you feel about the patient support group? So some of the things that you have told us is about that long COVID support group, which I think on our side is a plus. It's a new information that we can actually use in our practice. How did you feel about that? How did the support group help you?
So the support group that I'm referring to is, it was actually founded from the UK. My auntie was one of the people that founded it. But on the support group, it's open to everyone, right? So even though a majority of the people that are there are in Europe, some of them are coming from Asia, some of them Africa, some of them the United States, others Australia. So all around the world, there is a lot there, right? And the good thing about it is, if you're dealing with certain things, you can kind of just give a quick search on that, because there's been a lot of posts that relate to some of the symptoms that we deal with. And quite a lot is going to come up there. So from the support group, a lot of help came from there in, I think, about a few ways. Number one is noticing that, whatever I'm going through it's not an isolated incident, right? It's not an isolated incident, and it's not something I'm dreaming of, right? Because there are millions of other people going through the exact same thing, right? And when people describe it, it's like they're describing you. Even when you start, I'm pretty sure when people go there and start reading through those posts, you will notice that as you read through those posts, it's like somebody's talking about your exact symptoms. Every time they mention a symptom, it's exactly word for word what you have experienced, and the downside to it, I would say, would be that I did notice that, some of the symptoms I'll be like glad to say, okay, at least I didn't have that, right? But then somewhere down the line, maybe like 8 months or a year later, I experienced that symptom that person was talking about that I never had, and then I'm like, oh, okay, that's unfortunate. So it's finally caught up. But outside of that, yes, the support group was helpful in that one way. The second way was, just it's a safe space really to be able to speak about your experiences. Again, going through this, there's a lot of stigma that's involved in it. You can't really talk to anybody. Most people that you do try to talk to can't relate. And the monster that is otherwise known as long COVID is only something that somebody who's experienced can understand, to be fairly honest with you. You have to have experienced it. Otherwise, it just sounds like a fibble if someone's telling you about it. So the thing that I found with that support group was when you actually talk about your experiences, you are able to have a platform where you can have that safe space where you can talk about what you're feeling, what you're going through, and what you're dealing with. And I think that was really helpful as well. Yeah.
So Dr. Naik, to answer your question, the support group was a safe space that brought him more comfort because he got the chance to meet people who are experiencing the same. Okay. Is there anything else where they coming together or discussing about method that would improve their life?
Yes, so there's a lot there. There's a lot of different things that different people have tried that have helped them in different ways. Over there, again, mostly because people weren't getting the help that they needed from the hospital. So this is, I wouldn't absolutely advise everything, but there is that, and there is, of course, just the ability to be able to be honest with you, I don't think I would be here today if it was not for that group, right? I know a lot of people did take their lives dealing with this, even people that we had on the group, which is quite sad. And I can understand why. But, it's definitely something that I can say for a fact that has helped me to continue, struggling. I'm still struggling even up to today. I have no social life anymore. I had to even stop going to church. I love church, but I stopped. I haven't been since last year. What I noticed is putting myself out in the open, in public spaces and social environments, it kept on putting me in this cycle where I would constantly get sick again and back and forth. And I realized that it looks like my immune system has been really affected and I can't deal with just even general things. So I really had to make a conscious decision to disclude myself from everything and just isolate for a very long time. So for years now, I've just literally had to stay in my room, mostly alone, which has been very difficult to do, but I had to come accustomed to it. The only time I usually leave home is if I'm coming to the hospital or there's really something important that I need to do. And I try to schedule everything onto one day so that if I know, okay, this day I need to go out. So I try to do as many things as I can on that day so that I don't have to repeatedly go out, So I think that's kind of important also to share.
Thank you, Mr. Fabian. Ms. Boa, thank you for joining.
Okay. Good afternoon.
Good afternoon, Ms. Boa.
Yes, so I would just like to share a little experience of what I went through, and I've actually been to the COVID clinic, and I've been reviewed by you, Dr. Danielle, and Dr. Mwansa, because of the psychiatric concern that I had. So I'm previewed to these long COVID sessions because I'm a health worker. And I think my case was also presented some time back by you, Dr. Danielle. Yeah. So what I would want to say is that long COVID is something that I've now come to live with. I've accepted it. It was very difficult at first. I could not accept that is what was going on, and I had all these questions. Like Fabian said, each time I got to the hospital, all the investigations were normal, but it wasn't correlating with what I was thinking. And I was asking myself that, am I now going crazy? Because no one seems to understand what I'm going through. I know I'm not fine, but everyone thinks I'm fine. Yeah, so like I've mentioned today, I'm not able to go for work because the whole night I was in severe pain, headaches, my arms, the whole body is just in pain. I think the pain started on Sunday, and I also have the chronic fatigue. So that's something that I still battle with, the chronic fatigue, the body pains here and there, and also the forgetfulness. Apart from a whole lot of things that I had gone through, the major ones are the brain fog, I'm really forgetful. And I think I was helped when I went to the hospital. I was told what to do, and with time, I was also able to read a lot and come to acceptance. So it's not really something easy, because once I go into that phase of having pain, like I was literally awake the whole night. I'll take painkillers, they don't work, so I'll just wait for things to resolve. Sometimes it really gets to me, because I think, is this ever going to end? In as much as I've accepted, will I continue living like this my whole life? I had, plans for my future and whatnot, but it seems I'm not going to attain those things if I'm going to continue feeling the way I feel. So I get encouraged when I see such people giving their experiences. At least it gives me hope that I'm not the only one who's going through such. And I would also want to thank the team for, enlightening us with this information. Unfortunately, not so many people understand what long COVID is. Yeah, so I think that's what I wanted to share. Thank you.
Thank you, Ms. Paul.
I don't know if
So,
maybe just for the sake of others, I could just quickly go through this list, just very quickly.
just give us a
read
second.
them. Yeah.
So we have,
The problem there, that also.
so this one. So we have
Daniel, do you want to unmute your microphone?
Daniel. Mr. Daniel, who says that he used to think his mom was dramatic. Mr. Daniel, can you please unmute your phone, your microphone?
Good afternoon.
Good afternoon, Mr. Daniel.
Yes, thank you very much for this. I think it was a very good initiative. So I'm Daniel Nkandela. I'm based in Choma. So yes, mom had COVID, and from what we thought she had recovered. But no, she continued having these body pains. So she would wake up in the morning and say, no, I feel very tired. So we're like, I think, mom, you are trying to be dramatic, because there's nothing. You've been to the hospital, they've tried this and this, they've run a lot of tests. Sorry, I have a cold. I hope it's not COVID. Yes. So they did a lot of tests on her, and they all came out as negative. So we thought to say, I think somehow it could be old age or so. So she has been complaining of like several times. She would complain, no, I woke up with a headache today. I don't know why my joints are paining, my back, my neck, my arms, and like at some point she also complained of having some difficulties in breathing. She'll be like, no, I feel like there's something stuck on my throat. So my sisters and I, we put together some funds. So she was sent to Lusaka. She traveled to Lusaka where an endoscopy was done, and it was clear. So we're like, I think you're just being dramatic. So I think this platform has really made me feel guilty in that we've not really been supportive to her. I really feel bad now that I've learned to say, so this is really there, especially that I've heard it from somebody who's suffering from it. So I think this is different from what Professor Lloyd Mlenga had presented earlier on, where he just presents data and you think maybe this is from somewhere else and not really in our settings. But now being able to see somebody and hear their testimonies, and what he's talking about is something that I've seen in my own home, where my mom could complain and yet we couldn't offer her the support that she deserves. I think somehow it makes me feel a little, not a little bit guilty, but a lot more guilty, because I think, yeah, we didn't do so much. And obviously it's because of the knowledge gap, and like, yes, she has other comorbidities like the diabetes and the hypertension, but I think what she's been experiencing of late, not just of late, but from 2019 when she suffered the COVID. I think it could be the symptoms of long COVID. And I want to thank the organizers for this. I think we'll try and support her in that regard. Thank you.
Thank you, Mr. Daniel. I hope you apologize to your mother. So what
I
you have-
will.
Yes, please. So what you have said is very important. There has been many report on long COVID, severe psychiatric disorder, even people who are committing suicide, which has been reported in the developed world. But it's sad and then to note that we also experiencing the same. It's normal we had COVID, so it's expected that we are actually having people who are suffering from such disorder. So we hope that this platform it will be creating some safe space, and then which can also bring those people who are suffering from long COVID together, so we can learn together with them and come out with permanent solution. May I ask Mr. Fabian, what platform are they using for that long COVID?
So the long COVID support group, you can just look it up on Facebook, long COVID support group. It should be able to pop up. I'll try and see if I can just maybe leave a link to that.
So where do they leave their comment? Is it on Facebook? Is it on WhatsApp group? Like how?
So most of the things are spoken about on the group itself, but there are within the group, there are other invitations to other forums, right? Where you will have someone who will maybe help you with things like breathing exercises and, just helping you mentally as well, dealing with all the different things that are going on. So it is quite extensively supportive in the different spheres of what you might come to need as a person. And maybe just, is it Daniel? I forget the name. With the case of your mom, what I can say about that, my brother, is that be thankful that you still have her and you have a chance to make amends. I think that's the most important thing. You know now, you didn't know then, you know now. So it was mostly actions out of ignorance. The Bible says that, when we do things in ignorance, God even overlooks those sins. But when we come to understand, then he expects us to do better. And I think I would advise the same to you. So in the case of your mom, I think be grateful that she's still there. Some of us did lose people to COVID. I think a lot of people lost people through COVID, some even through long COVID itself, different reasons. But at least you still have that opportunity. So I would take advantage of that and try to do the best. I know it's difficult to deal with a patient, especially a patient who is chronic. I know I was dealing with one myself, my grandfather. So even knowing what his conditions were, it was still challenging dealing with all those different conditions. But I didn't understand what dementia was like until I had a bit of an idea of it myself. And then I started to really understand what he was going through. So there's just certain things that you can only, even when you know them, you can only really understand them when you go through them. It's just the reality of life, unfortunately. So we're grateful that you aren't going through that. But I think in the case of your mom, I think you can be now a little bit more understanding when dealing with that situation. Yeah. And I just wanted to, I don't know if we have time, but just for the sake of the others that are tuning in, listening, and those who have had, I just wanted to, without even mentioning too much on it, just quickly go through the symptoms that I've faced since the time that I first had the infection, if that's okay. I'll ask for guidance from the panel, if I can do that.
Yes, of course. Please.
Can I go ahead?
Yeah.
Okay. All right, great. So I started documenting. At some point, I got too depressed and I stopped, but I think there's a few of them that I documented, the things that I dealt with since the beginning. So morning sickness, what Sister Boa, is it, was talking about. Mrs. Boa, Miss Boa, I don't know. You correct me, but yes, morning sickness, I face that a lot. Even up to now, still have that problem. Every time I wake up, I feel worse than when I went to sleep. I think I mentioned that earlier. I had lots of lung problems. Heart problems, I did have this previously, but then it was exacerbated with this situation. I had some episodes with dementia. I had brain fog. I still have memory problems up to now. It's very difficult to focus on things that I'm doing. So I've just been trying to help myself build on that. Just trying to get my mind active, doing things that are mentally challenging. I even decided to take myself back to school to really take on a really challenging task, to try and, really exercise my mind, because it had reached a point where it was completely dysfunctional. And I won't lie, it's very difficult, but at least it's a task that I have every day to say, okay, I want to try and mentally focus to do this so that I can achieve that goal. So yeah, short-term memory loss, I just mentioned that one. Lack of coordination was really bad. There was a point where you might see me with a lot of hair, but there was a point where all my hair was falling out and I had to cut it off. And then I realized I might not have a lot of hair for a long time, so I might as well just grow it whilst I can. So, little trivia there. But anyway, other than that, loss of smell, I still deal with that. Loss of taste, this is quite depressing. Migraines, I still have these. Most of the times, painkillers don't even help. Blurry vision, dental issues, I mentioned this, brittle teeth, gum recession, issues with my nerves, so everything hurt. Chronic fatigue, I mentioned this as well, chronic pain, numbness, it started at night and then it grew over time, which was found out to be blood clots. Then there was loss of control in my left arm, my left leg, pain in my heart area. There was dizziness and vertigo. Started feeling like I was just rapidly aging for some reason. Anxiety and depression, I think those were mentioned there. The suicidal thoughts I mentioned earlier. At the beginning, I had a rapid weight loss. This was quite scary. I moved from 90 kilos all the way down to 60 in a very short time frame. So whatever I ate just came out the same way. There was no processing in my system whatsoever. This led to a lot of weight loss. There was shortness of breath, still deal with that quite a bit. Very sleepy. So I sleep a lot more than I used to. I used to have chronic insomnia, like really bad. If I sleep during the day, then I can't sleep at night, kind of bad. And that would, compound over the days. It would take months to recover if I disturb my sleeping cycle. But now, seems like all I can do is sleep for whatever reason and still not feel refreshed after it. Chest pains, I mentioned this. Heart pain, I mentioned that. Back pain, swollen eyes. Sometimes my eyes would just swollen shut, just out of nowhere. Just wake up in the morning and you can't see, only to discover your eyes completely closed. So intolerance to sound, this is the one I was talking about recently. The ringing in the ears feels like it's clogged, especially the left one. For whatever reason, a lot of people have it in the left one. And then joint pains as well. My knees, my arms, just general pain around. So these are some of them that I was able to, I know it's a long list, that I was able to compile. There was others that are not here that I kind of got too depressed to keep on, mentioning all of them. But just to give an idea, to people who are going through some of those things. These are the things I have dealt with over the years that I still, some of them continue to deal with until today. So yeah, there is that.
Thank you. That's such a long but also sad list. Sorry that you're still experiencing such. We are a bit late in our schedule, I'm sorry, but I would like to ask a question to the panelists on the call about Mr. Fabian, acknowledging the presence of Dr. Sombo Polosho, who is in the room with us, and Dr. Delao that have asked us a question. For this patient that is still experiencing such, is there anything we can ask for? more than what.
Yes, you can go ahead and ask. We can hear you.
Yes, is there anything we can, is there any solution we can offer to him apart from what he's receiving now from our specialists? He had brought up a lot of improvement on what we can do, the groups, but also he had emphasized that the medical personnel needs to be more empathic towards patients that are suffering that, especially that we are still not specialists on the long COVID syndrome. But on your side, Dr. Dalao, is there anything you think you can do or you recommend the patient to do?
Yes, I would actually again echo that. Look, what you have done and the journey that you've done, you've come up with your own resilience and coping strategies, and well done. And this is something that I would say, keep going at it. If you feel the online platform is a good space for you, please keep doing that. The other thing that I would actually recommend is if you'd be open to perhaps finding a therapist that understands you and you appreciate them for that, and perhaps having at least quarterly check-ins, not going for therapy, but just having check-ins where you go and share how you're experiencing and what this journey is for you. This will really help you ground yourself and also help you understand yourself better and promote your resilience further. But all in all, I wouldn't recommend anything in terms of medication or in terms of particular therapy. But if you would want, I would advise you to consider quarterly check-ins so that you can keep updating and equipping yourself and also understanding your psychological well-being better. Over.
Thank you so much, Dr. Lau.
Can I say something?
Yes, please.
So first of all, thank you so much. Special thanks to Sister Patricia Matilda, who helped us redefine a patient for this series. When we started this ECHO 2 years ago, we had insisted that we have some survivors come to speak. I did not think it would be like this. Chatonda and I have done ECHO for more than 7 years. I will speak on his behalf, and we've never attended an ECHO session such as this. Because right now my mind has flipped, because just a month ago we were being asked, do you think we should continue the long COVID ECHO? I could not answer that question, because when you look at those participants, that's only 26. Our ECHO platform can seat over 1,000 people. We have not done justice to this session. But I will say that there is a room. I tried to ask Kote to show it. There are over 50 people attending from Mazabuka, where Dalao is speaking from. And I need to say to ECHO India, I don't know how you can register those people. They need to give feedback for this session, because we've never had anything like this. I want to thank Danielle, Ms. Boa, and of course Fabian, for really being candid and honest. You've articulated it so well. And you ask us for answers. I feel we should be asking you, because you've reached out, because you felt, a lot of people come to us and say, I think I've got long COVID. I have never heard it described like this. You described something I knew about the loss of hair, right? I'm not a hair person, obviously, but I knew about the loss of hair, which is very weird because of just reduced blood supply. But the teeth, I had to look up when you said it, right? Why would they have teeth problems? So we are supposed to be looking to learn from you, because that's how these ECHOs are designed, actually. They usually have patient advocates such as yourself. We should be asking you what we can do for patients here in Zambia. We are very privileged to have 13 long COVID clinics in this country. And I can tell you right now, they are not doing so well. Our numbers are not so well. I think it's because we've been trying, us as healthcare workers, to find answers. So I'm asking you, people like yourself, Danielle, how do we work together to make this message go out? We just completed a study where we had 350 recruits. Longa can testify. We do have a questionnaire we sent, and it did go out to the country. We tried to engage Zicta, and people felt, oh, it may not be worth it. But now I see it's worth it. That questionnaire needs to go out. This country needs to know the burden of disease, because this is real. A lot of people don't know it. Just yesterday, I was talking to Kote that some people, they were asking, do you want to make a documentary about COVID? This is what we should be talking about. There's very little knowledge. You are very articulate. Your English is very clear. I can imagine being Bemba and trying to express myself to the doctor and say, this is what I'm feeling, I need help. So personally, Fabian, I do not have the answers for you. I can tell you the physiology. I feel that's part of it, isn't it? To say, we actually don't have answers. We don't know, but I can tell you, your teeth had these problems because maybe you were grinding because you're stressed, but actually there's reduced blood supply to your teeth. That helps so that you know, okay, this is not being imagined, right? Just to acknowledge the work that people in the long COVID clinic have done. It's been a lot because, trust me, there are doctors who tell us, why do people have that clinic? That disease does not exist. So we need to even bring it as far as the government said, these people exist. People, just today I was signing a letter. Somebody needs their pension. And how do I describe this to say, this person needs money to come to the hospital to get the care that they need. So really, I'm very excited that there are people like Fabian, Ms. Boa, Danielle. We as healthcare workers need to work with you, to learn from you and say, even as we create our materials, we need to co-develop. I do grants, and believe me, on grants, they tell us, develop those with them. They call them, the CSOs, right? The people that are actually experiencing the disease. And I don't think there's a disease that embodies that as much as long COVID. So we need patient advocates like you. We need the voice to go out. Actually, this we have done, this platform should have done 1,000 people. If I knew it would be like this, I would have described it. And obviously, you need to speak to physicians, right? We do have these patients, things like chronic fatigue syndrome. Before long COVID, this is another diagnosis would make in this country. So a disease that's unknown in a country, and now it's manifesting itself in long COVID. How many of these people do you think are out there that are not getting the help that they need? So unfortunately, you people like yourself, Fabia and Boa, you have a lot of work to do. One of the things I picked from what you said this time, I'm grateful to the doctor from ENT who gave me the time. It's not a medicine, but you're talking about time. And really, I would urge you to form a local support group. Really, you're talking about the UK support group. It's great, but it's not in our context. We need our own support group, and we need leadership for those support groups. People like yourself, people like Ms. Boa. So I think we're looking forward to working with people like you. We are definitely going to look into it. I want to really thank Sister Patricia, she's just been a star in our clinic. She made sure we got the patient for this. I want to thank Chatonda for taking his time. As for answers, I do not want to be the one to give you answers. I feel like you've answered so many things for myself. You are going to make me introspect, and I feel that we have not done enough for this population. We need someone at the level of the minister, the PS, to know that this is a real problem. Because diseases, they need money, they need funding. Just the team in Mazabuka is actually doing training on how we are going to distribute this equipment. We've bought some equipment for long COVID. And my biggest worry was, will we get the patients to use this? Right? So people like you, we need your guidance. So that's all. I'm not going to give any answers right now. My brain is really, it's blowing from this session. And I want to thank you. I've done ECHO 7 years flat, probably the longest in Zambia. Never, ever, ever did I think this session would be this powerful. So I want to say thank you. Of course, people like Dalao, Longa, everybody in Mazabuka, they are working very hard. I'll let Danielle pick it up. She's the facilitator. So thank you.
Can I just quickly respond to this? So yes, thank you very much for that. When I was contacted and asked if I would like to, come onto the platform, I simply just said, look, I know what it's like living with this. And if I had no one else that I knew living with this, which was initially my case for about a year of this experience, I don't think I would have made it through, and so I know that there are still a lot of people experiencing this, especially within our country, that probably don't even know what they're dealing with like I was. They were just equally as ignorant. So if I can be there to help that person understand better what they're dealing with and help them cope with that, I'll be more than delighted to do so. I mean, you can always even ask me to come again. I've got no problem. So long as my health allows me to, that's the only case that I have. But outside of that, I don't really have too much of a problem with that. Just to correct, the doctor that really took out a lot of time to help me was Dr. Chimanuka at the beginning. But like I said, there was a lot of, there wasn't enough knowledge about this at the time. So like I said, apart from him, other doctors that I did see, I can really relate to how difficult it might have been for them to really diagnose the problem, especially in a case where everything just comes back as normal. I would hate to be in their position, but at the same time, I hate to be in my position as well. So I can understand how it's difficult for both sides of the chair. Even as I'm sitting here, I am facing a lot of pain. I have to really put myself together to come out and, just be even moving around and, doing all these things. And I'm sure that everybody else experiencing this still is dealing with the same. Mobility is quite difficult, among other things. But yeah, I think the thing that I would strongly advise is that I think there's just been a lack of awareness. And I feel that there's a lot of room to grow, a lot to do to help in terms of awareness. I wanted to ask for the Zoom, the link to this Zoom, but I was not sure if it was supposed to be a private arrangement or a public one, because I did initially want to share it to a few people that I know that are going through this, or at least know someone going through this, because I said, look, they've asked me to come and speak on this. And I wanted to ask for the link, but I was really not sure if it was something that was open to the public or if it was closed, so I refrained from doing so. But I think that there is a lot that can be done. I know I work in the IT department, field rather. There is a lot that can be done to broadcast this, right? To be able to reach a lot more people. But a lot of it also has to be done in terms of sensitization and awareness. HIV, when it first came on the scene, people the same things happened, right? And it took a long time for people to actually become more aware. When they saw someone with HIV, they'll think, oh, don't touch him, don't do this. There was a lot of stigmatization. So, I think it's the same with pretty much anything that's novel that's just come out, So I think a lot of work needs to be done in terms of sensitization, liaising with the government, ensuring that people are made aware. Announcements are made on things, platforms like television, radio, all these different Ministry of Health should be announcing this, because there are people who are really suffering. And I mean suffering. I know, because I've never thought that I've been sick before in my life, but never imagined that I'll ever be this sick. And it's been a nightmare. It's not something that I would even wish on my worst enemy to go through, because it is really something that destroys your life entirely. So I think if we really bolster the awareness and help that in different ways, I'm sure there are different avenues to do that, it will go a long way in improving even the count of people that you have. You advertise something like this, put it out on the platform, give out that Zoom link so that people in the general public can also just come in and join in and see what's going on. That's just my suggestion.
Great suggestion. So thank you, Mr. Fabian, to have attended our echo session. We're also thanking the long COVID rehabilitation, those that are in Mazabuka, the panelists, Dr. Sombo, and then all the participants that were able to join. We thank you. We are also thanking you, Mr. Fabian, to come here to share. It wasn't just you sharing your experience, but actually it was more of a teaching session for us as well. We have gotten a lot of points from what you have told us today, and there's a lot of room for us to improve in our care, and we are grateful for that. So this is the end of our session. We thank you all, and then we see you in 2 weeks. Thank you.